This video is about chest pain. This video will outline the main causes of chest pain and why we may suspect one condition over another. Later videos will examine each condition in detail, linking pathophysiology to signs and symptoms, diagnosis and treatment, all within an A4 page. So we would categorize the pain firstly based on onset, whether it was spontaneous, which is concerning because these diseases could be immediately fatal, and whether or not it was brought on by exertion. We choose to categorize conditions based on onset because in your history, a question you would ask early on is, how long has this been going on for? Or, what were you doing when you first felt the pain? So we can use answers to these questions to set up our thought process. So if the pain comes on suddenly and the patient describes it as a severe tearing pain radiating to the back, you would be most concerned about aortic dissection. If the patient says they feel like vomiting and feel bloated, and it's also around the upper part of their abdomen, it could be a ruptured peptic ulcer. If they have trouble swallowing or dysphagia, an esophageal rupture is most likely. The next main category is chest pain precipitated by exertion. If the patient describes it more of a tightness rather than a pain, and it is relieved by nitrates, the patient is likely presenting with stable angina. However, if it is not relieved by nitrates, and the pain lasts for more than 30 minutes, you would be suspicious of myocardial infarction. Finally, chest pain could also happen gradually at rest. If it is a retrosternal burning pain, sometimes precipitated by lying down, the likely diagnosis is GORD. There is a more specific type of non-exertional chest pain called pleuritic chest pain, and this is when it hurts more to breathe in and can be associated with sudden shortness of breath or dyspnea. If there are respiratory symptoms such as runny nose, fever, etc., you would be concerned about pneumonia. If there's been recent trauma or a medical procedure, a pneumothorax is likely. Finally, if the patient has deep vein thrombosis risk factors, a pulmonary embolism is possible. So that is a quick overview of the different diagnoses for chest pain and why you may suspect one over the other. Thank you for watching. If you learned something or found it useful or just want to make my mom happy, please like and subscribe and drop a comment with any questions or any topics you want to see in the future.